Ptosis surgery is a procedure to elevate the position of the upper eyelids.
After ptosis surgery, patients can benefit from upper lids that look in a more natural place, which is higher, more open, and less sleepy looking. Patients also may appreciate not having to use their brows to try and keep their eyelids open. Sometimes they don't even notice that they've been doing that for years, as well as being able to read, watch TV, and drive at night a little easier without their eyes feeling so sleepy.
As oculofacial plastic surgeons, we specialize in ptosis surgery. The posterior approach for ptosis surgery allows one to elevate the eyelids without an external scar. At Eyesthetica, we have been pioneers in refining and quantitating the posterior approach. The Mueller's muscle conjunctival resection and the Façonella Servat procedure are both posterior approaches that we've published extensively on.
As oculoplastic surgeons, one of our core competencies is ptosis surgery. We do a ton of it, and there are a lot of different ways to do it. For patients that have minimal to moderate amounts of droopiness on the upper eyelid, we can often do the whole procedure without any external scar, going from the inside of the eyelid and tightening the muscle that raises the eyelid up. Patients have minimal downtime. There's usually only one stitch that comes out in the office 1 week later. There are two techniques that we have to use for the posterior ptosis surgery: the conjunctival Mueller's muscle resection, as well as the Façonella Servat. And having multiple different ways of doing it, we can usually achieve a really nice level of almost exact symmetry between the two upper eyelids. For patients that have more robust droopiness, we can get a larger elevation by external levator surgery, where we do make an external incision that's hidden in the eyelid crease, and we isolate the muscle and advance it and pull it down to the eyelid margin so the eye is more open. Candidates for upper eyelid ptosis surgery are patients that have a droopy or tired looking upper lid, or asymmetry in the height of the eyelid where one eye looks bigger than the other.
At Eyesthetica, we perform a full eye exam when you come in for a ptosis evaluation. We also check the position and measure the position of the upper and lower eyelids. We check for dry eyes. We also do visual field testing to find out the level of visual obstruction from the eyelid being drooped.
Patients that have ptosis surgery generally will have some bruising and swelling for 1 to 2 weeks. Those having posterior ptosis surgery usually look normal at about 1 to 2 weeks. After external levator surgery, patients may have some swelling that lasts up to 3 weeks.
At Eyesthetica, we always advise patients to stop blood thinners 1 week before surgery. In addition, if they're on medication such as Coumadin, that's usually stopped 3 days prior to surgery, but started up the day after surgery.
Immediately after ptosis surgery, patients may not be able to close their eyes fully for the night after surgery. We usually recommend using topical lubricants and ointments to keep the eye moist as the muscle of eyelid closure is recovering from surgery.
Usually after surgery, we advise patients to use ice packs 2 to 3 days after the procedure. After that, they use warm compresses until all the bruising is gone.
After upper eyelid surgery, most patients are able to continue their activities of daily living, bathing, cooking, doing such things, but we recommend avoiding heavy lifting or strenuous activity for 1 to 2 weeks. Vision can be blurry for a few days, and that usually improves as the swelling on the eyelid goes down.
We normally see patients 1 week after surgery and remove their sutures. After that, usually 4 to 6 weeks later, we reevaluate them to see what the final result is.
Oftentimes, when patients have upper eyelid ptosis surgery, they choose to do lower cosmetic eyelid surgery as well to combine healing time and time in the operating room. Combining upper eyelid surgery with lower eyelid surgery gives more of a wow effect because the both upper and lower lids are rejuvenated.